when the person survives their brain injury, they end up, depending whether it's mild, moderate, severe injury, you would end up with lots and lots and lots of problems. Somebody may have a very mild injury, go to A&E, and they say, oh, you've just had a concussion, your CT scan is fine, and they keep you in for a few hours, and then you're back home. That person then develops post-concussional syndrome or some other effect of mild injury, and they struggle for months and years to come. Sometimes if they're unlucky and they see a psychiatrist or a medic who doesn't know his stuff quite well, then they'll go, it's all in your head, and that's it. Of course, it's the brain, so it is in their head, but then they're not making it up. This, and I'm sure all of us in this room have seen people with mild injuries, and that's that. But there are those who suffer moderate injuries. They may be knocked out for between 30 minutes and an hour. They come round. Glasgow Coma scales were maybe around 10, 8 to 10 or something like that. And they went into hospital. They had a brief period of confusion called PTA, and then they came out of that. Or they may have been in hospital with severe injuries. They may have had brain surgery to remove a tumor or a blood clot or some other problem. And then PTA, the confusional period, they have been prolonged for a period of time, and they end up being discharged from hospital. Sometimes they discharge home, because if the person could walk again and talk again and sound okay, they get discharged home. And it's only when they get home and they're living with families, for those things, that problems start to emerge. You start to think, this person's emotions are completely different. We're getting mood swings and behavior change. This person's memory is not as good as it was. They can't organize themselves. Bills are not getting paid. They're not sorting out themselves. Everything is a mess around them. Or this person's mood is not okay. They're anxious, they're agitated, they're depressed, and various other issues. Or they're walking, something's different about the way they walk. There's problems with their balance and coordination and various other things. Or they may start having seizures, for example, and then you go in and you go, take this medication. The medication makes you sleepy and affects your gaze and worsens the cognitive problems you have, and then it becomes a vicious circle. So when the person's had all these problems emerging after their injury, some may emerge immediately after, but often you have months down the line before some of these cognitive and emotional and psychological, psychiatric, neurocognitive, neurobehavior problems then emerge down the line. So it's very, very, very crucial that you have a good team to support the rehabilitation of that person. Also, you have to also think of what sort of brain was it before he got injured. That is very, very, very important. Because I once had a gentleman who was going through his rehab program, and we were wondering why he was struggling to just relearn how to make a cup of tea and to tidy his room. As a young man who was about 19, and one day his mom came and said, well, I did everything for him before. Never tidied his room. I mean, anybody, of course, he's a teenager, and the boys and the rooms and all that. And he never did that before. So it's very, very important to know the kind of brain it was before. Because sometimes it's not new things that emerge, but worsening of traits that were there before. So when you understand what the person was before they had the injury, you go, yeah, they had a short fuse, but it's now a lot shorter. Yeah, sometimes they get forgetful, but it's a lot more poorer than it was. So it's important to look at that. And then the environment they came from. I had somebody last week who was swearing at me, and I thought, has he got this disinhibition that Phineas Gage had back in the day? And then I met his dad, and then I met his mom. and then I understood why there's F this after and before everything this person says. So it's very, very important to understand where the person's coming from, please. So when you put where the person's coming from together with what sort of brain was it before it got injured, and then you look at the part of the brain that's been damaged and what it does, and the effects from that, and you put all of that together, then you have a good picture of what that sequelae after the brain injury will be, what their disability will be, and you have lots of new behavior problems, psychiatric problems, emotional problems, cognitive problems, and the rest. And that would lead to that social handicap, and the most important thing, the loss of independence. It's crucial. Autonomy is something that is even found its way into ethics and human rights and everything else we do around. We're all independent, we want. When you've had a brain injury and you lose your independence because you can't organize yourself, you can't think through things properly, your behavior is bringing you into conflict with society and the law and within the family, and you can't manage it all. You can't return to work, you're struggling with relationships and all of that. It all impacts on your independence and your ability to fit into the world properly. So, next slide. Rehab then comes in. Because if rehab comes, the goal of rehab here is to maximize your ability to return to your pre-brain injury level. And that's the target, that's the basis of rehab. Where was this person at before? Where's this person now? What can we do to bring them as close as possible? Being realistic, though, about all of that. If it's not possible, it's not possible. But at least the goal is to bring them as close as possible to achieving that independence. So it would mean that you'd have to retrain people in various activities of daily living, because being independent means that we manage all our affairs, and there's different kinds of activities of daily living, personal ones, domestic ones, and other types, and therefore there'll be various assessments. The OT may do some of it, the psychologist may do some of it, and various other people in the teams will do that. Now, pain is also very, very important to deal with, because brain injury, the brain helps you to process and interpret pain. You may have physical injuries from the brain injury that the person suffered. So pain management is important. Then you deal with the other physical and the cognitive and the behavior problems that arise from that. And you have various therapies that you have to do over a long period of time to be able to get that person as close as possible. And then, where necessary, you may decide, does this person need medication? What sort of medication do they need? And you have to factor all of that in, and there's a basis for that, because if the person has cognitive issues, their speech is difficult to understand, they have sleep problems and the rest, and you're giving them medication, especially some of these psychiatric drugs, and they're going to numb things and make the person slow and slurred and all that, and affect their cognitive functions, then you're making things worse for them. So you have to think through the use of medication carefully. Also, we all belong to families, and sometimes the person surviving brain injury may not be aware the extent of injuries they've had, but the family is aware of what the person has lost and how they were before. So it's very, very important that as part of rehab, you support families as well, with family education, counseling, and all that, and then you support carers and everybody else. So the rehab part here is very, 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 very important. The brain is not able to repair itself. It's not able to heal itself. If it did, Phineas Gage would have got back, healed his brain, and then returned to what he was doing before. He had a fantastic job. Rehab, I know we all sign up to, we all believe in it, and we all do it. There's loads of evidence that the effect of brain injury for those who may have suffered moderate injuries is lifelong. If you've got cognitive difficulties, it doesn't suddenly stop. You've got difficulties lifelong. If you end up with some psychiatric problem, psychosis, major depressive disorder, it could end up being a lifelong problem that you have to manage. And therefore, rehab is not something you sit the person in the classroom, you do it for 3 months, you give them a certificate, you've passed your rehab, goodbye. No, it doesn't work like that. It's something that you have to do continually the rest of the person's life. And it's very important that families, the survivor, commissioners, and everybody understand that, and they understand the meaning of rehab. Because sometimes they think rehab is that initial intensive work that you do, and then that's it. No. If you've got a bucket that's leaking and you want to fill it with water, you keep topping up. If you stop, you drain it. And that's why sometimes when somebody's package of care is working so brilliantly in the right setting, and somebody goes and says, this person is doing so well, we don't see any evidence of all these things in our checklist, and therefore we're moving this person away because they're so well. You're asking for trouble, because this person's got lifelong problems, and they're in the right setting, they're getting the right package of care for the rest of their lives. So you have to seriously think through before you move somebody on, so that you don't set them back. Because sometimes when they lose some of these gains they've made, it's very difficult to get it back. So rehab is very, very,